Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. This is a special meeting of the Board to consider two motions. To start, in the spirit of recognizing the harms of the past, promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Committee, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories in which they live and work as well. We are grateful to those who have come before us and mindful of those who will follow us as we steward and protect these lands. I want to take a moment to thank Albertans for continuing to turn out in great numbers to get the first and second doses of the COVID-19 vaccines, as well as the AHS teams that are helping Albertans get immunized. More than 5 million doses have been delivered to date in Alberta. We can go higher. The most senior public health physicians and experts have repeatedly emphasized the importance of being fully vaccinated, so we encourage everyone to get fully immunized. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who are opposed or abstain, I will declare the motion carried. I ask that someone move the approval of the agenda that has been circulated.
Tony Dagnoni, so moved.
Thank you, Tony. Will someone second the motion?
Deborah Ann will second that motion.
Thank you. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest they would like to declare at this time?
Brian Vazjo here.
Please, Brian, go ahead.
Go ahead, sir.
Thank you. Well, I will jump in. My apologies, Brian, for speaking over you. It's David Wyant. I have a conflict of interest with respect to the matter that is the Resident Physician Services and Compensation Grant Amending Agreement, and I will not participate in the discussion. As chair, I would only vote in the event that there was a tie, but I will not be voting in any event. Brian?
Yes, I have a conflict on the same item. I am on the University of Alberta Advisory Committee to the Dean of Medicine and Dentistry, and I will not be participating in the discussion, and I'll be abstaining from the vote. Thank you.
Thank you. Are there any other conflicts of interest based on our agenda? Okay. With those declarations, we will move on. In the board materials were a set of minutes for approval, minutes from the June 1st, 2021 and June 28th, 2021 public board meetings. May I have someone move approval of those minutes? Thank you, Saye. Will someone second the motion?
It's Sherry Fountain. I so second the motion.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried and the minutes are approved. I will now ask Vicki Yellow Old Woman, Vice Chair of the Finance Committee, to present the Finance Committee report.
Thank you, Chair. The Finance Committee met on 22nd, 2021 and considered two items for recommendation for board approval. First, the committee considered terms and conditions for an agreement between Alberta Health Services and K-Bro Linen Systems, Inc. The committee recommended that the board approve Alberta Health Services entering into such agreement. The board members support such approval. Accordingly, I move that the Alberta Health Services Board, 1, approve Alberta Health Services entering into an agreement for the provision of laundry and linen services between Alberta Health Services and K-Bro Linen Systems, Inc., effective August 1, 2021, on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that the management of Alberta Health Services considers necessary or advisable, and 2, delegate the authority to the Alberta Health Services President and CEO to execute the document to effect such agreement on behalf of the Alberta Health Services Board in accordance with the delegation of authority and establishment of controls for commitments policy.
Thank you, Vicki. Will someone second that motion?
I'll second. Jack Mintz.
I'm not hearing anyone. Is there a seconder for that motion?
I think Jack. Yep.
I apologize.
I did
Jack.
second it.
Thank you. My apologies. I didn't hear you. Is there any further discussion? Any opposed or abstentions? The motion is carried. Vicki, you have a second motion.
Yes. Second, the committee considered amendments to the grant agreement for resident physicians services compensation. The committee recommended that the board approve such amendments. The board reviewed the proposed amendments and the members supported the approval. Accordingly, I move that the Alberta Health Services Board, A, approve amendments to the Alberta Health Grant Agreement for the training and compensation of postgraduate medical education students who work in Alberta Health Services facilities and provide clinical services as part of their educational training to provide funding for the academic year July 1, 2021 to June 30th, 2022 on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of AHS considers necessary or advisable, and B, delegate the authority to the AHS President and CEO to execute the agreement to effect such amendments on behalf of AHS in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, Vicki. May I have a seconder?
This is Heidi. I will second.
Thank you, Heidi. Is there any further discussion? Any opposed or abstentions? The motion is carried.
Brian Vazjo here. As previously noted, I'll be abstaining from this vote.
Thank you, Brian. Although we've reached the end of our business agenda, I will declare the business meeting adjourned. I would ask that everyone stay on. Our CEO and President, Dr. Verna Yu, has a message for us. Verna?
Thanks very much, Dave. I'm just really glad to be here with everyone today, and just want to start off just by talking about gratitude. As we all know, we've worked tirelessly through the COVID-19 pandemic, and really the efforts have been extraordinary. I just want to say thank you again to everyone. Salute all our staff, physicians, and volunteers for all that they've done. This week, we've announced some changes to our pandemic response due to the low levels of COVID-19 cases and continually increasing immunization coverage. We are scaling back our contact tracing and case investigation teams to align with the current case count. Again, I'm really grateful to all of those who have served on those teams who have been a cornerstone in our fight against COVID-19. We are going to maintain a robust team that will continue to actively investigate and contact trace new cases, and we'll have the ability to scale our efforts up if needed. We also announced this week that we're going to close the rapid flow clinics at the Expo Center in Edmonton and at the TELUS Convention Center in Calgary by the end of the month. Albertans will still be immunized at multiple locations, including public health centers, pharmacies, physician offices. Appointments and drop-in opportunities are readily available. Again, want to thank all of those who worked in these clinics and also everybody who's taken part in our immunization campaign. But we do know that more needs to be done, that immunization is really the best way for us to return to a normal life and move beyond the pandemic. And definitely we are beginning to see a changed world, which feels really good. And this is also true within AHS. As we demobilize parts of our pandemic response, we are able to turn our attention to core areas such as surgeries, and we are seeing great progress already. So whether it's during the pandemic or not, there is one constant. AHS is there for you to provide Albertans the health care that they need. In the bigger picture, redeploying staff from the pandemic will help fill staff vacancies, and we can focus more attention on key areas such as addictions and mental health, because we know there's a huge need out there. So on that note, I'd just like to acknowledge that it's been a very difficult year and a half for all Albertans. I hope everyone's able to take some time this summer to recharge. Please take care of yourselves and each other. And back to you, David. Thank you.
Thank you, Verna. And thank you all for joining us. Please be safe and well. This meeting is concluded.
Together, we do amazing things every day.